A lot of people are asking the question right now, what causes autism? And the best science is that we don't know. But the most likely thing is there will be multiple causes. So we think there is likely a gene-environment interaction that is leading to autism. And a lot of people think actually that there might end up being multiple forms of autism and different causes for different forms. We also know that accessing diagnostic services is a major factor in being able to get a diagnosis. So not only do we have the interaction of gene and environment, but we also have the service setting that you're in and the ability to get care as another major factor. There have been a number of studies looking at Tylenol and autism, and there have been a few that have shown a weak association, meaning that if someone took Tylenol, that there's a little bit of an increased likelihood that that person ended up having an autistic child. But the best studies have shown, and the largest studies have shown, that those associations actually tend to go away when you take into consideration other factors. So the best science right now shows that there is possibly a small association between Tylenol and autism, but what most people think is probably going on is something like maternal fever, maternal illness of some sort may increase the risk of some developmental concern. And what do you do when you have a fever or an illness? You might take Tylenol. So while it's associated, most of the data suggests that it's not actually causal. The best science would say yes, Tylenol is safe to take while pregnant. It is currently considered one of the safest pain medicines during pregnancy. I think we want to think really hard about pain control during pregnancy and making sure that we're offering pregnant people pain medicine that actually helps, because we do know that there's also some consequence to having uncontrolled pain or uncontrolled fever during pregnancy. So we want to make sure that there's safe medications for people to take during pregnancy to address their pain. There have been a few very small studies that have found a small benefit in a subpopulation of autistic children when it comes to their communication skills and folic acid. So I think a lot more research needs to be done to understand that the use of folic acid in autism, but I think the best science suggests that there will be a small subset of autistic children who will have a small benefit from folic acid, but there is certainly no one talking about folic acid as an actual cure. And as you know, I think we have to be very careful in thinking about the word cure in autism, because many people in the autistic community really take a lot of pride in their identity as being autistic people. And we're not trying to erase someone's identity. I think we want to be very cautious about suggesting anything like that. As you know, my philosophy is that we want to help all people, including autistic people, live their best lives, whatever that means. If getting a diagnosis early, if having social support or medication that's going to help you live your best life, then I personally, and we at the Shriver Center, are very supportive of that. But we're not trying to prevent people from being themselves.